The authors do not have any financial interests in the subject matter of this video. After seeing the title of this video, you must be thinking that it's highly futuristic. But we made this video to bring to your notice the imminent problems around and to emphasize the need for expanding our scope of treatment if we are to deal with these effectively. We are aware that antibiotics are developing resistance. Retinopathies are not resolving with anti-VEGF injections. The outcomes of certain procedures are not predictable anymore. Lubricants do not improve a patient's symptoms of dry eye. But what is the solution to these problems? Old practices will definitely not open new horizons. We have to gear up and get ready for the future. We recently came across this paper, High Definition Medicine, which highlights the future horizons of diagnosing and treating disease. The first step is to understand the role of high-definition medicine. It will provide us with options of bespoke treatment, more evidence-based practice, and ultimately, highly predictable outcomes. But for this, we need extra tools for personalized high-definition care, like biomarkers, genetics, behavior analysis, tissue engineering, and advanced imaging. Let's take a look. We can obtain various biosamples from the eye and collect them in Eppendorf tubes, store them in appropriate conditions, and analyze them. They give us our biomarkers. We have proven the role of such biomarkers in keratoconus, diagnosing retinopathy of prematurity, predicting the progression of myopia, and preempting corneal ectasia. The next step is to know the ingredients of genetic analysis and its role in the diagnosis, treatment, and the future of therapy. We can approach many diseases genetically through genomic analysis, in which the next generation sequencing is the latest method. Biosample and pedigree analysis are primary tools involved in it. Let me give you examples of diseases that can be diagnosed genetically. Studies have shown that syndromic and other associations of congenital cataract can be diagnosed using new DNA testing. Researchers have also found a new gene associated with retinitis pigmentosa. Researchers have been able to map the whole human genome, thus making the identification of a disease gene and its therapy possible in certain conditions. Rho kinase inhibitor is also one of the novel genetic tools in trial that have been shown to help cure endothelial dysfunction. CRISPR therapeutics is the future of gene therapy that aims at curing disease at the molecular level using breakthrough gene editing technology. Our next piece in the puzzle is whether behavior has any role to play. The difference in a patient's subjective post-operative outcomes following the same surgery in different individuals also has a great impact on management, which can be analyzed using different questionnaires which are available to us. Tissue engineering is the most recent advancement in medicine. We can now artificially culture cornea, which may eventually allow us to eliminate corneal blindness. Lastly, newer machines, artificial intelligence, and predictive modeling can help clinicians to open a new dimension in the management of a disease. Latest machines like the Brilliant microscopy can help us to understand corneal biomechanics better, Polarization-sensitive OCT can aid detailed imaging of the cornea, the RNFL, and the RPE. Artificial intelligence is now also useful in ophthalmology in predicting posterior capsule opacification. It also has a role in the fields of glaucoma and diabetic retinopathy. Now, prediction of outcome of treatment is also possible with the help of technology like mesh modeling of the cornea in keratoconus. But at the end of it, the million-dollar question is, how does all of this translate to our daily practice? Let's take an example. Symptoms like frequent change of glasses, itching, and eye rubbing do point us towards a diagnosis of keratoconus. But apart from topography, we can now also use biomarkers and genetic analysis for diagnosing the disease. We can then predict the outcome of treatment. Similarly, other diseases like retinitis pigmentosa and retinopathy of prematurity can be treated using these high-definition techniques. The prescription, which is now blank in 2018 for the lack of a truly customized treatment, hopefully few years down the line can be filled with a personalized HD treatment. We are halfway through, only halfway to go. Let's progress.